Welcome to Thursday Thought Leaders with Arvindo Narula on BW Healthcare World. My guest today is Gautam Khanna, who's a distinguished CEO of PD Hinduja Hospital, renowned for his exceptional leadership in the healthcare sector. Mr. Khanna has been at the forefront of the industry insights and has navigated through dynamic trends, offering a unique perspective on intersection of healthcare and finance. His strategic vision has contributed to the success of PD Hinduja Hospital, making it a prominent institution in the healthcare landscape. Let's speak to Mr. Gautam Khanna to understand his perspective on the healthcare industry and how the hospitals must be managed. Welcome to Thursday Thought Leaders on BW Healthcare World, Mr. Gautam Khanna. You've spent about 14 years with a hospital, and it's a long time. It's more than a decade. So, what are the changes that you have observed in the healthcare delivery domain in the last 14 years that you've been here in this sector?
So, I have been in the hospital space for 10 years. Before that, I was in the medical device space, but 10 years is good enough to talk about the changes. One of the changes which I have noticed, Arvinder, is like the patients have become very, very aware. And earlier the position was that the patient would come and look at the doctor and the hospital as somebody who will deliver healthcare to them. Now, at some level, they are expecting it as a right, so they demand good healthcare. So that's a little subtle difference, but that's the difference. The other thing is there is a lot more technology being used. And it's also because, like you talked about Google and YouTube, people are used to technology. People are used to doing things on the phone. So if we don't move with technology, it is difficult for the patient. So now more and more hospitals have turned to technology. For example, now very few large hospitals, you will have to do paper booking or appointment on the phone. You can do it on the phone. You can pay online. You can see reports online, all those kinds. So that's a big change. We don't realize it, but what used to take 1 or 2 hours before takes 5 minutes now. So that's a change. The other change is now there is a lot more outcome focus, in the sense it is also related to maybe the society is becoming more litigious. So there's more litigation coming. People are more, doctors and hospitals are more careful about doing the right thing because, you will be sued. So there is perspective on that. The other thing which is happening in the healthcare delivery is that, when if I go back 10 years, at that point in time, the focus was on expansion, that everybody wanted to have more and more hospitals. And there were many greenfield projects, there were expansion across the country. Over a period of time, the realization has come that it is not the physical expansion that matters. Of course, it's important, but what is important is to consolidate and to ensure that the physical structures which are present in other cities are operated efficiently. So that's why you see now more and more acquisitions, etc., are brownfield. So some hospitals which are not doing, somebody is taking them over, making them more efficient. So it is now talking about efficiency. So earlier, if it was scale, now it is efficiency, clinical outcomes, and a little more depth. So that I think is a broad thing, and plus so much technology change. People are talking of home care, people are talking of remote monitoring, etc., etc. But let me stop at that because I think there'll be many more details to talk about.
Mr. Khanna, prior to this, you've been in the medical devices space. You were with 3M earlier.
Yes,
right? 3M. Now, how do you find managing a healthcare delivery system or managing a hospital different from managing a product organization?
So let me put it this way. There are two perspectives. One perspective as a personal leader. One is the organization. So as a personal leader, a leader of the organization, which I was in 3M earlier and now I'm here, I think the skills, many of the skills are transferable. For example, the focus on people, productivity, outcomes. So those things are common. The and the systems approach on managing operational rhythm and so on. So those things are all common. So that means any CEO from any product company can move here. So I'm giving them an opportunity by this so that they can think of alternative. But jokes apart, I think the difference is in a product company, uh, irrespective of what we say, but mostly the sales happen, at the month end or in the last week, or there are a few days in a month when the sales happen. And that is your moment of truth. That have you sold it, not sold it? What are your results for the month? And you're focused on the quarterly result, monthly result, annual result, so on and on. Then there are factories where you ensure that every day some X amount is being produced. And if it is not produced, you fix the quality, you make up for it next day, and so on. So that is a little more, you can do a little more planned approach. Even if you make a mistake, you have time to correct it, etc. While in the hospital or the service space, the moment of truth is every day. Every patient who walks into my hospital, that is the patient, that's a moment of truth, because when he has interacted with my security, with my doctor, with my nurse, with my admission clerks, and with the reception, etc., etc. So to ensure that the service is maintained and results are on a daily basis. I mean, every day, it's like an airline. If you miss the seat is empty, seat is empty. So the results are on every day. So the other thing is, in a hospital environment, the complexity is much more. It is not because it is a service industry, but it's also because it is in public service. So there are many more stakeholders who have influence on what you do, whether it is politicians and NGOs and social workers and staff and the relatives, the community, etc., which in a product company you're actually quite insulated. You really don't worry about it. So I think that's the thing. But the difference between the two is that our service industry is more complex, more satisfying. Hospital, of course, is a much more satisfying thing, because every day, like I was speaking to a friend of mine yesterday, and he told me, I mean, he's a very big banker internationally. So he told me, he says, we never help people, we just make money. And at the end of the day, we just play golf and sleep, and that's all. But people who are in the hospital space, in the healthcare space, every day you can sleep at peace saying that today you have done something good for the society, and so on and on. So I think maybe I digressed a little bit, but that's what I think, from product to service and service to a hospital. That's a big difference.
No, I completely understand. I think it's a very important point that you brought out. The mindset of a CEO or the leader at a hospital or any service sector, especially hospital, has to be very, very different. I mean, like you said, that you can sleep at peace every night, knowing that you made a difference today to someone. So empathy, I think, is a very important aspect of a business leader managing a hospital. Mr. Khanna, a lot of things have changed and advanced in the healthcare delivery domain in the last 10 years. We spoke about it, and a lot of things also changed because of pandemic, right? But in the last year or two, the tech advancement has been, something which is noticeable,
Yes.
So what is it that you think are some of the trends that you saw in 2023, which could continue and make an impact in 2024? And what is it that PD Hinduja as a hospital is going to be doing to remain ahead of the curve in terms of delivering healthcare or quality healthcare?
Let me put it this way. We've been seeing the trends, but it got accelerated in the past few years. And as you mentioned, last year, and I don't know whether it's last year's data, there are around 3,500 health tech startups in the country. And it's my firm belief that people like us, we don't do innovation. We just provide good service. We do incremental innovation, little bit improvement. People who are the health tech startups, they will do the disruptive innovation. So they will change. I mean, they'll have a step change. So I think those people are making a difference. And one of the things which the industry is doing, including us, is we are collaborating with many of these health tech startups to see if their solution will work in the hospital. Now, for example, we've all talked about remote monitoring. Now, there are solutions present where you can monitor remotely within the hospital, so that a nurse who's managing 15, 20 beds is able to see on her nursing station the vitals of a patient who is not visible in some other room because of some sensors, etc., etc. So that is a technology which we have already adopted, by the way, and I think we love it. It's that my nurses get more time, the doctors are relieved that patient is being continuously monitored. So that's an example. The other example is the change in the digitization in the world. Everyone is moving to more digital. So whether it is, I mentioned about online reports, online appointments, online consultations, all those things have accelerated. Although surprisingly, online consultations are down. This is surprising. But everything online is up. I think because people like to see the doctor today physically. But online for follow-ups is okay, but not as a first consult. And the other thing which is happening is the focus on research in genomics and personalized medicine. See, if you are thinking the way it is going to go, medicine is now going to emerge. Medicine needs more technology. So the marriage of medicine and technology will be the future of healthcare. So in the sense that, of course, we know the thing about robotics, and now we know that there is more AI coming even in our conventional MRIs and PET CTs, etc., etc. It's coming. But over a period of time, more and more AI, more and more predictive technology will come in the hospital. And by the way, we are adopting, we are trying out experiments in small pockets and seeing which will work. The thing which will happen for a hospital like us, and which is what we want to do, and I don't know, anyway, nobody knows the future, but we do what we have to do today. We think that in the next 3 to 5 years, we should be so digitally advanced that there should be no paper, and it should be an integrated system where a patient is digitally, patient knows us digitally, we know the patient digitally, and we can do a seamless transaction, whether it's a delivery of healthcare services or anything else. I think that's what. So for that, you have to make your internal systems very, very strong. Plus, then you have to have opportunities to deliver the services outside. The other thing which is happening in the future space and what we are trying to do, one thing which the pandemic taught us is that irrespective of how senior or experienced the doctor is, you still need technology. And so many doctors have started embracing technology. So there is now whether what is the right technology to embrace, that's a different thing. But there is an opportunity, and they're open about embracing technology, which is what is helping us to deliver and become more and more efficient. Now, how I see myself as in the hospital, as of course, we'll be expanding physically because India does need more beds. So we will be expanding physically, whether here or elsewhere. But we will also be delivering more home care. We will be doing more remote monitoring. And I think it's a question of 3 to 5 years where we will have more opportunity to do what we call as elder care, what earlier used to be called geriatric care. Because, most families are nuclear families now, and parents are staying alone and some are abroad. So if we are able to deliver that, it will help. And to just top it all and just say the last thing, till now, we have been focused on delivering the best clinical outcome. That now is going to be augmented, in my view, with delivering the best clinical outcome with the best patient experience. So the patient experience with the outcome is going to differentiate a superb hospital versus a good hospital. So, these are some thoughts. We don't know what will happen in the future, but that's what we will try to do.
Mr. Khanna, when we talk about delivering experiences, it all comes at a cost, you know.
Yes,
And as a business leader or a leader of an institution, we have to ensure that the institution that we run is a sustainable business.
absolutely.
Because much as we would want to do the work that we really want to do in a manner that it is appreciated, we still need to ensure that the institution is able to deliver what it is created for. India is a low cost, high quality provider of healthcare, right? We are not affordable for the citizens of our own country, right? How can we manage cost yet equip ourselves with the best equipment and the doctors to provide good quality, affordable healthcare in India? How do you balance the finance in healthcare to make this happen and create a share, and while also creating a shareholder value for the promoters?
You know, Arvindo, this is a question which most people ask all the time. And there are two aspects to this. The question, the phrases you used, one, you said affordable healthcare, and then you said quality. So you put both in the same sentence, right? So let me first say that the quality we should not compromise, because in my view, an Indian human body is the same as the American human body, as the same as a European human body. So I should not differentiate from the treatment and the diagnosis type of it. So I don't think we should compromise saying that we are Indians, so forget about this. No. So we should look at that. Now, if you think about it, that what the way to do this is, we should have an appropriate system of healthcare, that who goes where. In earlier time, we used to have a GP, a family doctor in our neighborhood. Now, for every fever, people run to a super specialty tertiary care hospital and go to see an internal medicine specialist and pay $3,000 because that's what his consultation fee is. But you really don't need to. You need to see your GP. So we need to have a system of GP, primary, secondary, tertiary care. And people like us, we are tertiary and quaternary care hospital. So we should not be seeing the primary care. So that is one way, I think, if we develop an infrastructure, but that is not done alone. It has to be done along with the government. So that is one aspect. Second aspect to this is that not everybody needs a 3 Tesla MRI. As they said, that 1.5 Tesla can do 98% of the 95% of the job. So in a city where where the affordability is a little low, please don't focus on 3 Tesla, do 1.5. And then you move them to a larger city if there is complexity. Or there are now coming to 0.5 Tesla. I think some companies are experimenting. So you just keep going down. And as complexity increases, then you start moving to the higher level. So that is the other thing. The other thing is about affordability. You talked about affordability. I will switch the thing. I don't say affordability, I say ability to afford. So there are difference in the two. So when I want to buy a car, I may not means, I'm saying that somebody wants a Mercedes, they cannot afford it. They don't even have the ability to afford it. Okay. But if somebody has a financing mechanism, they can buy that car. So the financing mechanism in healthcare is insurance. So whether private insurance, whether it's government insurance. So if there is more and more insurance, you have the ability to pay. And when you have the ability to pay or ability to afford, then you go for better healthcare. So, like, for example, many years ago, and I remember taking this mission on myself to tell all my friends that they need to increase the healthcare insurance premium value. Most people had 3 lakhs, 5 lakhs. In today's metro city, 5 lakhs will not get you anywhere in 10 years' time. It will be 15 to 20. So in a single room for some surgery or whatever, it means another 10, 15 years. So you need to enhance that. And we have to get away from the thought that I need to paisa vasool the insurance. I have paid the premium, I have not utilized it. Please don't utilize it. It is Good that you don't utilize it. So I think the insurance, people need to pay so they firstly they need to have adequate insurance and they need to have insurance. So these two things will help the affordability. The other thing which is built into this quality and affordability is that there are a lot of these corporates now who do CSR, and they do CSR. If we can redirect the CSR money towards healthcare, that will really help the healthcare institutions, because that's what we do, that's what our job is. So we have to have a channel where government says, okay, if you invest in a healthcare, you get a little more incentive, you pay something. Now coming back to running the hospital profitably. So like in any P&L, there is you need to manage the top line and you need to manage the costs, and then you get the bottom line. So top line is not only revenue from the beds of the hospital, a patient who pays. It is also from other services. The way to enhance it is that, yes, you do whatever you can within the ethical framework of delivering the outcome to the patient, but you also have an opportunity to expand. Like I said, home care. You can do things outside home. You can do preventive health checkups. So you are enhancing your revenue streams. So you look at that. Then you focus on operational efficiencies. The more efficient you are, the lower costs you have. And you cut costs very, very systematically. So it is, you don't leave any loose costs anywhere in the system. That will lead you a very efficient network, efficient hospital. You said it about this, but as a hospital, see, you have to earn, because I have to invest it back into buying the new equipment. I have to pay salaries. I have 4,000 people working for me, whether, doctors and staff. And so there are 4,000 families who are delivering healthcare to maybe 1 lakh people a year. So 1 lakh patients a year, I need to provide for people who take care of them. And I need to upgrade my physical infrastructure. I need to upgrade my equipment. So this thing about making money is okay, because you need to earn, so that you need to give back to the hospital. The unfortunate part is, if we start thinking of hospitals as a business, then we think it is a business where I have to, like today I earned EBITDA of 18, then tomorrow I have to give 20, then 21, 22, 25, 30. That is a problem. Because I think for healthcare, the investors should also know that they may be getting a 5% lower EBITDA, but the goodwill and the blessings they are getting from the patient is much more than that. And I mean, it's not tangible, but I think that is something to be thought through. Because if we want to have healthcare for the people in the country, it cannot be only be driven by profit. It has to be driven by quality outcomes. It has to be driven by focus on patient care, and it's not goodwill. It is about doing good to the community. So I think if we do like that, we should be able to do. And I firmly believe that if we run the operations efficiently, like any corporate would, you will have a good, well-run, efficient, reasonably profitable, I'm saying reasonably profitable hospital system, which is not a problem. And on the lighter side, if you have a problem, hire guys like me and we will do it.
That's absolutely great. Mr. Khanna, actually, what you said is very, very important. Making profit is not a problem. It is an institution needs to be profitable to invest back into growing the institution. The problem happens when you're trying to profiteer from taking advantage of situations of the patients. I think that's where we need to be mindful of. Coming to my next question, Mr. Khanna, what is it that PD Hinduja Hospital does that which is different from what everyone else is doing? And how do you maintain a position of a leading institution by creating innovation within the hospital? Like you said that innovation happens in product companies and other companies. You are just delivering healthcare. But when it comes to managing the hospital, like finances, cost management, building efficiencies through how you design your hospital, what does PD Hinduja Hospital does, which is helping them maintain the leadership?
I mentioned about innovation, but in the service also we do a lot of innovation. Actually, in the hospital we do, in the sense the way. So, and most of the innovation will come in terms of how you are delivering the clinical services, whether the way doctor is delivering, the way you are giving the patient experience, and you do things differently. You manage the organization, you manage the hospital. So there are things which are done in the hospital and maybe at some other point. Lots of innovative stuff is tried in the hospital, which we do. The thing about, you mentioned about how we keep our leadership. I don't know what others are doing. I know a little bit, but I can tell you what I am doing. So what we are doing is, see, our hospital is focused on three pillars. One is the clinical delivery. Basically, we treat patients. Second is academics, where we have DNB in 26 specialties and nursing college and MSc, PhD, and BSc programs. We also have MSc in biology with from Bombay University. So we have a clinical research program, fellowship, etc. So we do lots of these things which help the academic side, which I firmly believe that when somebody teaches, they learn more. So my doctors are teaching, so they're learning more, so they're getting more proficient in the clinical delivery. Then there is a lot more focus on research. So doctors are doing research at national level, international level. We are doing global projects. We are doing projects with NIH in the US, with UK, with South Africa. We are doing WHO projects. So these engagement on the research side, on the academic side, helps the clinician deliver good outcomes. The other part of this is our focus is on patient care. We never ask, we never give targets to the doctors. So there's no target. All I want from my doctors is, please do the best you can for the patient. Because if one patient is healed well and goes back home, no problem. Somebody will take care. We will have enough patients. There's enough patients in the country. But what we need is, I don't want somebody to be focused while delivering patient care that my mind is not on patient care, but my mind is on revenue. No. So that's one. The second thing is, our rates are all published. So it's transparent, it's ethical. So whatever the patient sees before admission, they will pay maybe plus minus 10% depending on the surgery, but they know what they have to pay. And what we do is, we say, do what you say and say what you do. It's very easily said, but implementing it on a day-to-day basis, when you get the feedback from patients, and we are very, very strict about patient feedback. When we get the feedback, we go after it. We will go to the depth of it, try and resolve it so that it doesn't happen again. And those things help. We have quality circles in the hospital. We have quality teams. We have, we are NABH or accredited, CAP, and so on and on. So all the quality systems are in place. But on other thing, there's a simple thing which I want to share with you. You may think it's too simple to be shared, but I'll tell you why it makes a difference. We do not allow anybody, any patient, to give any tips to any staff in the hospital. Now, it's a very simple thing because it's very common in India to give tips, and all hospitals give tip, and people expect tips, and family wants to give tips because they are so grateful that they want to give tips. But you know what it does? The moment you give tip to this fellow starts differentiating between people who give tips and don't give tips. So his behavior is different. So we said, no tips. You want to give, you give it in a big box so that I'll share it with everybody. Second thing is, if a staff is caught taking tips, they will be sacked. So that means everyone treats every patient equally, whether you're in general ward or in the suite class. So that makes a difference. Second thing is, I remember 10 years ago when I came, so the patients, the workers, like new CEO, we want to come and give gyan to everybody. This is what my 3 priorities are. But when I looked at my audience, I said, I don't think they want just 3 points of patient care, productivity, teamwork. They don't want all that. They want it in Hindi. मुझे करना क्या है? So then we said, okay, what you have to do is you have to take care of your patient as you would take care of your family member, parent, brother, sister, wife, husband, child. That's all you do. Once you say that, things change in their mind. And also, you emphasize to them, and I did some calculation and explained to them how till now they have got blessings from 1 crore people over the last couple of decades. And 1 crore people blessings are make a big difference. And people have seen staff workers, people who are doing sanitary attendants, their children have become doctors and engineers. So, they can make out. So these are some things which are very intangible things. But, there is another thing. The doctor's payment is not dependent on the patient bill. It is not. So the doctor has no incentive to keep the patient extra few days or to do extra tests, nothing. The doctor is getting paid for what he's doing, and that's it. It's fixed. It's on printed. So what that means is there is no unnecessary treatment being given. There's no incentive. So, maybe it's not one thing. Maybe I think it's a combination of all the things. And over a period of time, we have excellent doctors. We have Padam Shris. People are known nationally, internationally. And, this ethos continues. So maybe that's what it is.
Fantastic. I mean, that's so beautiful because you spoke about the support staff and how they bring in equality of care to everyone, and also like you said, they wanted to know karna kya hai. Because in most places the support staff, the receptionist does not know why she must be a pleasant person.
Yes.
They know they've been told that be smiling, be pleasant, but they don't know how that pleasant smile contributes to the larger scheme of things in the hospital. So fantastic. Mr. Khanna, let me come to public-private partnerships. How has PPP gained prominence in healthcare delivery infrastructure? Because infrastructure is the biggest cost for a healthcare delivery system.
Yes.
And from your perspective, how significant is the role of PPP in making healthcare more accessible? Affordable ki to humne baat kar li, but accessibility itself is a problem.
Yes. I think PPP is probably the best way to bring accessibility to the masses, because whatever we say, but government infrastructure is present in most of the areas in the country, whether it's small, big. So the only unfortunate part is many of those government institutions are not run in a manner in which they should be running, and patients are not getting satisfactory treatment. It's because of many reasons, because of lack of staff, lack of other things. So I think PPP really helps. The combination of a private sector efficiency and the way to run it with the infrastructure of the government, I think it's the way to go. The unfortunate part in this is that many times there is that mistrust between the government and the private, where one side feels that the other side is there to make money, and the other side feels that this fellow just wants to take advantage of me and not pay me. So I think the reason why it has not done so well in the country is that if a private fellow is going to run a public infrastructure, they need to make money. Now, whether the government gives them grants or charity gives or whatever, somebody needs to pay the salaries, somebody needs to pay for the equipment. So it's not that the government hospitals are free. I mean, you see the budget of AIIMS. AIIMS is free, but the government spends thousands of crores every year on AIIMS. So that if you put it in a private sector, they will also need the same cost. So you cannot say. So I think this mindset that I don't want to pay the private sector and you should do it out of the goodness of your heart is not going to work. Goodness of the heart works only if you have to do a limited level of care, and maybe in small area you have some philanthropic view, you do it. But if you want to expand, scale, it will not work. So government has to find a way of reimbursing that. Second thing is from the private side. I think what private side needs to know is Of course, you need to make money, but please tone down your expectation of money. It is not that you're getting it free, so you will milk the infrastructure. We have to do it because it will help. It is helping the country, and we have to think about it. The more the country progresses, the more the country is healthy, I also benefit. So it's not a question of, you know, why should I do it at 10% or 20% lower than my regular prices? Because you see the numbers you get there, the experience which your doctors will get with the scale and the kind of patients they see, that will come back to better clinical outcomes in your hospital. Your the more and more doctors will like to work with you because you are attracting good, high quality doctors with high values, which itself is enhancing your healthcare, reputation. So I think that way it is both ways. Initially, PPP started in diagnostics, which has done well in some areas, but there's some room to grow. But hospitals delivery, it's still not done very well because I think the mindset of a public sector doctor versus a private sector administration is a little different. So I think they will have to sit together. And maybe one of the things which I suggest to some people is maybe when you have a PPP, you draw out an SOP saying that these are the things we will do, these are the things we will not do, and once you agree, only then you go into PPP. Don't enter into PPP and then you start having a fight. So I don't know if it answers your question.
Absolutely. I think what I hear you say is also that you have the presence of government institutions in these areas, but they need to be managed in a manner that they can deliver what they've been set out to deliver and
Yes.
managed efficiently, like a private institution where you're managing your costs and your revenues, so
Yes.
that you're not never under pressure. The revenue could be coming from the government, but it has to come from somewhere. You know, you also touched upon the point of, you said trust. You know, now we've seen trust diminish from the healthcare system. People when they go to a hospital, they're scared to even go for a diagnostic test, saying that अभी जाएंगे तो stent तो डाल ही देंगे वो लोग. What do you think needs to happen so that we can win back that trust and faith that the people need to have in the healthcare delivery mechanism or system in India?
I think the big responsibility is on the healthcare sector to it, and the media also. The reason I'm mentioning, like I gave you an example. I gave you the way why we don't charge we don't pay the patient, doctor based on the patient bill. That's an example. If I highlight that to the patients, so patients know that it is not going to be unnecessary, the test will not be unnecessary. You need to highlight things like that. Or if you talk about, how many patients have actually benefited. And we have examples in the hospital. Every day we see examples where somebody has come for a regular health checkup, and then one thing leads to another, and then you find within the same day that this person is diagnosed after multiple tests and there's a 100% heart block, and then artery block, and they have to be operated the next day. So if you had not done the tests, you would not have found out. So they're not unnecessary. But so we have to give examples that why it is necessary to do these tests, and sometimes, and it is important for the hospitals to build trust with the community and say, okay, you see for yourself that what, like I've mentioned, this is what we charge, this is what we do. If it works for you, fine. If you don't works for you, please go to somebody else. I'm not going to charge you more, but these are my costs. I am in Bombay. My infrastructure cost is 3 times of what it is in some other place. The other thing which is important, I think, for the community, which people are not doing, is to have focus on the preventive health checkup every year after a certain age. So what happens is then you know that what are you prone to. And if you're prone to, you will go to the doctor on your own. So it is not that you will think that, oh, today I have something, I'm going to the doctor, he will cheat me. You know that this is what it is. So, it is both ways. And all I can say is one of the things which the media can help is, instead of focusing, and I'm not talking of you, Arvinder, but talking about other newspapers, instead of focusing on that this hospital delivers third quarter results, EBITDA up by 46%. That's the wrong news to give. You should say this hospital has delivered, 3,000 patients are healed. These are examples of benefit. These cases, patients have been healed. These are some, so focus on the patient. So, patient also starts thinking that hospitals are meant for clinical care. Right now, general public reads the Eco Times, Financial Times, Mint or whatever, and they see, oh, they're making a lot of money. So it is both ways. And I think the other way is we need to tell the story that, maybe it's one more minute digression. When the doctors started going into medicine after class 12th, how many do you think wanted to go into medicine because they wanted to make money? Zero. They only wanted to go because they are passionate. Because if you're not passionate about helping people, about taking care of patients, you can never become a doctor and never become a successful doctor ever. So that's a given. So think about it. So the doctor is really concerned about taking care of the patient. So he's not thinking about money. Of course, it's important to have money. Lots of people have money. IT guy has money and so on and on. So I think we have to give the little dues to them. People who have become nurses, they have not become nurses because to make money. They're really compassionate. The people who are working in a hospital, they could have working in a hotel. They could have been working anywhere else. So they are giving a part of their lives to helping patients. So this needs to be highlighted to the community. So it's not only about money. So I know.
And Mr. Khanna, we have 3 minutes left and I have three questions.
Sure.
Right? So one is, when we're talking of efficiency in the healthcare system, healthcare delivery, hospitals, funds, management of cost, etc. Today, we've seen a trend of investments coming in to the hospital from private equity.
Yes.
Now, their motive is to make money and ROI, right? What is it that you have to say about this?
It's funny that you ask, because many people have been saying that if you get private equity money, you will be focused on profit. I want to twist it the other way around. What does private equity give? Private equity gives you money. Okay. So when they give you money, they want a return, which is fine. But think of it from a hospital point of view. It's in my interest. If I want to grow, if I want to go get more technology, if I want to get scale, I need more capital. So now I'm getting it free. Not free, but I'm getting the money. So as a hospital, what I should utilize, I should take private equity money only if I know that it will help me scale up. It will help me get more technology. It will help me improve my operations. So what happens in a private equity world? So they are actually not worried whether you're going to make 30% EBITDA or 25% EBITDA. All they're worried is that if today you are making 2%, when they exit, you should be making 6%. So that for their investment has become 3 times. So think about it. So they want the multiple. They don't want the percentage. So as a hospital, when I get private equity money, I should focus on scale, technology, improving my operations, because that money will go, but I will remain. So I should utilize that to become a big, prominent healthcare provider who can help the community at large. So that's my view. So I really am not against private equity. It's money coming in and I need money for expansion.
Expansion and building efficiency so that you can actually, lower the cost, etc. And the second thing that, I really wish to ask you, Mr. Khanna, is about the quality being maintained. Now you have accreditations that happen, you get your certificates, NABH and everything. But is that just enough? But once you get the certification, once you get the accreditation, how do you as a business leader ensure that the quality parameters are maintained in the hospital as they should be?
One is the regular stuff that you have a metrics and you need to monitor the metrics on a monthly basis, so which we do. And if there is anything which you have to be flagged off, you tell the department and you focus on that. So that is one aspect. Second thing is we review it on a monthly basis and quarterly basis. It's a big meeting where quality, all the teams and all the departments are involved, whether it's clinical, nursing, staff, admission, billing, etc., etc. So everybody is focused on the quality. The other thing which we have done, and I mentioned this, this is the example we have taken from the automobile industry, where they have quality circles at each point in the factory, where the regular people who are workers are actually giving you ideas for improving quality. So that we have implemented across the hospital. So each small department has a quality circle. So it is their solution. So the worker who's there on the floor or in the admission is telling us how to improve quality, and we implement that. And I'm telling you, that is the best way to improve quality. We have all the Six Sigma, NABH, everything we have, 5S, but that's the most effective. And then, it also depends on what the management wants, what I want. We don't compromise on quality. So if people see, actually people, what they say is people do what they see you do, not what I say. So if I focus on quality and I actually see, if I ask questions, are you've not done this, this is how you should do. And if I've told them how to do a better quality, they follow. But if I just sit in my office and say, I think you should have better quality, nobody's going to. So, some examples, maybe at a later stage we can discuss.
Got it. My last question to you, Mr. Khanna, is that, I see a lot of books behind you. Are you an avid reader?
I am.
What is that one book that you would recommend to the leaders of today to read? And second is, what is your leadership mantra that has helped you succeed in what you do?
I don't know which book I would suggest to read, because I've read many and most. Okay. I think what we need, and I in interest of time, I'm going to summarize it. The regular leadership principles of agile and process oriented and leadership, multiple leadership styles, situational leadership, all those things are given. What I want to tell the people is, don't think of a leader as only taking care of the stakeholder who is above you. There are people who are below you. So and around you. So the juniors, the peers, the seniors, the stakeholders learn to do a stakeholder management. Then think about it. And I am not against capitalism at all. Okay. Because I think capitalism is important. But what I want to do is, I want to add one word to that. I want to add the word called compassionate capitalism. That don't be ruthless and don't think that you are the leader. That's why you have the authority to do whatever and whenever you say. You also have to understand that because of some reason, God knows whether he has done or God knows, and you have just been lucky because of the support of others that you have reached this position. Tomorrow, somebody else will be in this position. So just have gratitude. There is so, and without the team, you cannot do anything. A leader without a follower is zero. So, and follower will be with you only if you lead them, not if you manage them. And you know what I say, like I mentioned earlier, leaders, I really believe in this. People do what they see you do and what they see you not do. People do what they hear you say and they hear you not say. People do what they see you act and they see you not act. So one, as a leader, one has to be very careful, and one has to be thinking that, is this the right thing to do? And my last advice to all the budding leaders, always do the right thing. It doesn't matter who's pushing you. For us, our job is to take care of the organization, then the others, whether it is your board or people or customers. Organization and customers or patients come first. So when you keep that mindset, everything will fall in place. You will not do the wrong thing, and always do the right thing. You know that you have to go back home and sleep, and tomorrow you might be in the same position as the other person. You don't want to be affected by the wrong decision. So just do the right thing.
Fantastic, Mr. Khanna. These are pearls of wisdom which are going to be really useful. I mean, it made a lot of sense to me. And thank you so much for taking our time. Things that I heard you say is that, one, uh, you believe that the doctors should be purpose driven. They should be outcome driven and not focused on revenue or targets, etc. And what should be driving them is the purpose and the empathy. The second thing, when we were speaking about affordability, you brought out a very, very important aspect, which is, kind of changed my perspective of thinking is the ability to afford instead of talking about affordability. And last, the suggestion of companies to consider CSR money fund the healthcare delivery could change the mechanism of how healthcare delivery could be funded. With that, I must thank you for taking out time to speak with BW Healthcare World.
Thank you, Arvinder. It's been a pleasure to speak to you.